Namaskar friends, I am Shubhra Sinha, your course instructor, and this is lecture 5 of module 7 of the stress management course. In this lecture, I have summarized some practical tips to reduce stress associated with chronic illness. In this part, we will talk about the practical steps that can be taken to reduce stress in the life of the patient as well as the caregiver. These strategies are related with the physical, emotional, social and self-care domains of life. In order to alleviate stress generated from chronic illness, one must take a holistic approach. Because the illness is chronic, it is going to stay for a long period of time and sometimes maybe for a lifetime. The stress associated with it is of course chronic. Off and on, with the change in the diseased condition, the level of stress will also increase and decrease. But of course, it is not going to leave you completely. When the stress is pervasive and it is long lasting, it is always better to take a multi-pronged approach to deal with it so that one can save one's own physical, mental, social, work related life and maintain an optimum level of performance in all domains. So, if I begin with physical strategy, I must say that all the physical strategies listed here help us in two ways. First, they act as a preventive measure against developing chronic diseases. So, if I exercise regularly, I do some sort of yoga or I simply walk in the morning or I swim or I engage myself in any kind of physical activity, I am going to delay the expression of chronic diseases if I am not able to completely do away with them. For example, if somebody has a history of diabetes in his or her family, he or she may be vulnerable for the disease of course, but an appropriate life management can help him delay the expression of the genes responsible for diabetes. So, instead of developing diabetes at the age of 42, a person can delay it for 10 years further, thereby reducing the level of anxiety and maintaining an optimum health status for a longer period of time. So, these activities which I am going to talk about can act as a preventive measure. Secondly, if I have already developed some sort of chronic illness, unfortunately, these strategies can become a part of the lifestyle management program and help me get best results from the treatment, from the medication which is going on, because they act as a synergizer with the main course of treatment. So, their capacity as a prevention, as a preventer of disease and their capacity as a supporter of main treatment course is highly appreciable. So, everybody must engage in these kind of activities. So, let us see what I have in this package. Of course, we have talked about exercise, any kind of exercise, aerobic, yoga, walking, swimming, playing badminton or even dancing. Whatever is fit for you can be chosen, whatever is interesting for you can be chosen. so that you can continue with this exercise for a long time. If I opt for an exercise form which I found difficult or which I find very uninteresting, I will not continue with it for a long time. And continuity and regularity is important. For many aspects it is important. So, select your own exercise, but be regular with it. Spend at least 30 minutes of your life daily doing some sort of physical exercise, so that you can maintain your health. Take good sleep, 7 to 8 hours of sleep and a regular sleep routine is highly recommended for a healthy life. Not only the duration of sleep should be proper, but the routine should also be regular. Routine should be regular means one should try to fix up a time of falling asleep and getting awake in the morning as far as possible. Of course, some deviations will be there according to the environmental demands, but as far as possible one should try to regularize the sleep pattern and also keep the duration between 7 to 8 hours. The third aspect is taking proper diet. If we are not consuming a balanced diet, of course, it is going to affect our health status in one way or the other. We must prefer whole grains over processed food and try to take fruits instead of juices. Freshly prepared food is the best option, especially for an environment where we live in, which is warm, hot and humid. So, one must take care of what the person is eating and at what time. Relaxation should be a part of your life. Relaxation exercises can include deep breathing exercises, progressive muscle relaxation, meditation and mindfulness. Embracing mindfulness technique is beneficial for maintaining the presence and clarity in diminishing anxieties related to past experiences of illnesses or upcoming possibilities of having some sort of undesirable outcome related with the health. So, mindfulness helps person focus on the present state instead of getting absorbed in the past experiences or thinking a lot about the future outcome that can be undesirable, but of course not in one's own control. The next popular strategy in this series is journaling. If we are overwhelmed with emotion, I can release it either by talking to somebody I can confide in or by writing my own feelings and the causes of those feelings. Repeated writing of the emotional state also helps me develop a proper perspective of my emotions. Establishing support system is again very necessary, as I was talking in my earlier lectures also. If I am in contact, in touch with my family, with my friends or support group, they can provide me with the most valuable emotional support and physical help as and when I need it. I can also take the help of counselors and therapists if I require to do so without any hesitation. This is applicable for the patient as well as for the caregiver. The caregiver can also develop mental health issues, and the patient, of course, a patient who is suffering a lot for such a long time is very much prone to develop mental health complications. So, both can take the help of professionals if it is required. Then comes the social strategies, that is communicating openly about the health state with the health professionals, family and friends can clarify the needs and concerns of the patients and has a potential to lower the stress levels. Joining a support group which is composed of people who are suffering from similar problems or who have already successfully managed those problems can be a boon in this condition, because the patient derive a lot of moral support from such instances and also learn a number of practical tips to manage their own health conditions more effectively. Engaging in social activities like hobby clubs or spending time with loved ones can have a positive impact on one's mental health, thereby reducing the stress and enhancing the overall well-being. Similarly, respite care, that is temporary arrangements for patient care that can last for a few hours, a few days or maybe a few weeks depending upon the demand of the caregiver, can offer a temporary break to the caregiver to return to his or her normal life. Similarly, self-care strategies are must. I would like to mention a very important point here. When I write prioritizing activities, it means one has to be very particular about what should be done in the limited time available. Friends, in our life we have two types of activities or two types of tasks. One are the achievement oriented tasks, responsibilities, roles that we need to play. The other type of activities are usually pleasure oriented, associated with our quality of life, associated with deriving more and more pleasure and satisfaction from life. In other words, doing what is required and doing what we want to do, because it simply gives us a lot of pleasure, a lot of positive vibes. So, when we are suffering from chronic illness or we are taking care of somebody who is suffering a lot, and in both conditions the person would be overwhelmed with negative emotions like worry, anxiety, overburdened, financial strain and lot many things. Also, very limited time is available to do the things which are important. One should be very careful in prioritizing one's tasks, and some time must be spared for doing activities which leads to pleasure, which leads to happiness, which are targeted towards improving the quality of life, instead of spending all the time in activities which are merely obligatory to the person or which are achievement oriented. Achievements can wait for a while. Perhaps we need more happiness and satisfaction when we are ill or when we are taking care of somebody who is suffering from such kind of things. Of course, there is no such rule. It depends upon the time, it depends upon the context, it depends upon the person who is actually involved in it. But the thing is, one must not underestimate the need of happiness in one's life. So, prioritizing activities is something where we must comprehend the situation in totality. We should look at all required tasks which are to be performed and then select our priorities carefully. Establishing limits is of course important, because we are already burdened, overburdened. Refusing activities which are not so important for the moment is a good strategy to keep our burdens within limits. If we keep on as adopting responsibilities, accepting tasks one after the other, we will not get enough time to think about those activities which we have committed to recently, and of course not enough time to look at our own health condition or our own mental health condition. So, one must learn to say no to all those activities which seem unimportant for the time being, or that can be given to other people. Self-compassion is a rule here. One must look at himself or herself the way he or she would have looked at other people, some friends or loved ones, when they would be doing the same thing. Mostly we are very strict to ourselves. We try to delay our own demands, we try to simply postpone the self-care activities for oneself. So, that must not be done. Self-compassion means being kind to oneself also. And while being kind, we must be able to take care of ourselves while taking care of other people. We must recognize our personal limits and try to take essential steps towards decreasing the workload, stress, and improving the overall well-being. One must not hesitate in seeking professional help when it is actually needed. That's all for the lecture. Let us have a quick recap of what we have learned. So, the important points that we covered in this lecture was about the practical tips for managing stress related to chronic illness for the patient as well as for the caregiver. These include strategies related to physical health, for example, exercising regularly, taking proper sleep and eating healthy food, doing some sort of relaxation exercises. The package also included emotional strategies like observing mindfulness, doing journaling, utilizing therapeutic methods if they are required. Social strategies were also there in this bag, and they were maintaining communication, being in touch with the support group, participating in social activities, and implementing respite care strategy whenever required. And finally, we learned that self-care strategies make the important part of this package, and one must be self-compassionate by prioritizing activities, establishing limits, trying to reduce the stress and the workload, and seeking professional help whenever required. This is the reference and recommended readings for you if you want to enhance your knowledge further in this field. You can also refer to the books of health psychology to know more about these topics. Thank you very much for your patient listening.